Right, junior obstetrics and gynecologists, if you use that report to justify outpatient hysteroscopy in Ireland, you are doing women a vast disservice. Those figures are not trustworthy. Why? Because there's been several studies done, some older, some very recent, that show complete opposite. The VASH trial showed 25% severe pain by the time you take out those that withdrew from the trial because they wanted to swap vagiscopic for speculum, and there was other few things going on. You end up with 30% severe pain. The one easily found done in Cairo, 30%. The one easily found in Canada, 30%. We're coming across a pattern here. The one done in Wimps Cross Hospital with the VR for distraction technique actually found 75%, although I've been told there was operative mixed in amongst that. But with the distraction technique went down to 40%. There's several ways those figures could be obtained. One, you're not actually doing outpatient, you're actually giving some sort of anaesthesia, either Voltarol, Tramadol, or sedation, Mesalazine, because gynecologists that have very high success rates, like Sergio Hamovich, he uses 10 milligrams of diazepam. In Iran, all operative is done under sedation. In Saudi Arabia countries, they tend to use a lot of opioids like Tramadol, although not exclusively. You'll find high success rates do not use nothing, they use something. It could also be that they're very low risk patients, that they've had given birth naturally, they're not postmenopausal, and they've even could have had a hysteroscopy before. There's a list of things you could get super low risk patients. Also, the group's very small, but to get that result still it's the local very, very careful selection. At the end of the day, those that cannot be trusted. There's so many more studies done. I believe it would be incredibly unprofessional if you used any of that information whatsoever to justify any outpatient hysteroscopy in your country, because there's so many more studies done, so more reliable studies. And I mean, we're not, if someone had a really bad time where they thrown out of the study, it's not right. Do not accept it on face value. Do not promote such things without looking at them properly, because will you look at other studies? Because when you look at other studies, you will not get the same results. Why? Ask yourself that. Why will I not get anywhere near the same results? Please remember, I have been in contact with several women that say they will not have any further treatment. Outpatient hysteroscopy in England and the UK kills more women than it saves. Statistically, if you put all of them through in outpatient on the theatre, one woman would die every 2 years. Far more die because they will not access further gynae treatment. And I say not just hysteroscopy, smear tests, ultrasounds, anything. It kills more women than it saves. So, please, actually do some research. Thanks, bye.